Welcome to this educational video about ColQ deficiency, a rare and fascinating neuromuscular disorder. In this video, we'll explore the causes, symptoms, diagnosis, and management of this condition. Join us as we delve into the complexities of ColQ deficiency and understand its impact on affected individuals. ColQ deficiency is primarily caused by mutations in the ColQ gene. This gene provides instructions for making a component of the enzyme acetylcholinesterase, specifically the collagen-like tail subunit. Acetylcholinesterase is crucial for breaking down acetylcholine, a neurotransmitter that transmits signals between nerve cells and muscle cells at the neuromuscular junction. Mutations in the ColQ gene lead to a deficiency or dysfunction of this collagen-like tail, thereby disrupting the proper localization and function of acetylcholinesterase at the neuromuscular junction. The pathophysiology of ColQ deficiency centers around the disruption of neuromuscular transmission. The reduced or absent ColQ protein causes acetylcholinesterase to detach from the synaptic basal lamina at the neuromuscular junction. This detachment leads to an accumulation of acetylcholine in the synaptic cleft, which overstimulates the acetylcholine receptors on the muscle fiber. Over time, this chronic overstimulation causes muscle weakness and fatigability. The disruption also impairs the normal clustering of acetylcholine receptors, further contributing to impaired neuromuscular transmission and muscle weakness. ColQ deficiency is a very rare disorder. Due to its rarity, precise epidemiological data is limited. It affects individuals worldwide, with no particular predilection for specific ethnic groups. Since it is a genetic condition, it is generally inherited in an autosomal recessive manner, meaning that both parents must carry a copy of the mutated gene for their child to be affected. The signs and symptoms of ColQ deficiency typically manifest in infancy or early childhood. Common symptoms include muscle weakness, particularly in the limbs and facial muscles. Affected individuals may experience delayed motor milestones, such as sitting, crawling, or walking. Other symptoms can include fatigability, drooping eyelids, difficulty swallowing, and respiratory problems, particularly during infections. The severity of symptoms can vary widely among individuals, ranging from mild weakness to severe disability. Diagnosing ColQ deficiency involves a combination of clinical evaluation, electrophysiological studies, and genetic testing. Electrophysiological studies, such as repetitive nerve stimulation, can reveal characteristic abnormalities in neuromuscular transmission. Muscle biopsies may also be performed to assess the integrity of the neuromuscular junction and the presence of acetylcholinesterase. However, the definitive diagnosis is established through genetic testing, which identifies mutations in the ColQ gene. ColQ deficiency doesn't have distinct subtypes based on specific ColQ mutations in the same manner as some other genetic diseases. The severity varies from patient to patient. This can be related to the type of mutation or genetic modifiers present in the individual. The treatment for ColQ deficiency is primarily symptomatic and supportive. Cholinesterase inhibitors, such as pyridostigmine, are often used to improve neuromuscular transmission by slowing down the breakdown of acetylcholine. However, the effectiveness of cholinesterase inhibitors can vary, and some individuals may not respond well. Other supportive measures include physical therapy, occupational therapy, and speech therapy to improve motor skills, maintain muscle strength, and address swallowing difficulties. In severe cases, respiratory support may be necessary. As a genetic disorder, there is currently no way to prevent ColQ deficiency directly. However, genetic counseling and prenatal testing can be offered to families with a history of the condition. This allows prospective parents to understand the risk of having a child with ColQ deficiency and make informed decisions about family planning. The prognosis for individuals with ColQ deficiency varies depending on the severity of the condition and the effectiveness of treatment. Some individuals may experience relatively mild symptoms and lead a reasonably normal life with appropriate management. Others may have more severe symptoms that significantly impact their mobility and independence. Ongoing research is focused on developing new and more effective treatments for ColQ deficiency, including gene therapy approaches aimed at correcting the underlying genetic defect. These advances hold promise for improving the long-term outlook for individuals with this rare neuromuscular disorder.